Hello everyone. In today's video, we are going to discuss about the terminal methods sterilization. There are two types, male sterilization and female sterilization. Male sterilization, popularly known as vasectomy, female sterilization, also known as tubectomy. Let us discuss about male sterilization. It is a simple operation which is performed even in the primary health centers by the trained doctors. Under the local anesthesia, this technique or procedure is performed. When this procedure is carried out, it has to be done under aseptic technique so that there is no risk of mortality. To avoid any complications and death, it is encouraged to perform, or it is mandatory to perform under aseptic conditions. In vasectomy, what do? They remove a piece of vas deferens at least 1 centimeter after clamping it. Also, there are new methods which are new scalpel vasectomy, no scalpel vasectomy and keyhole vasectomy, which is the new method, no scalpel. Here they are not using any cut, they are not going to perform any cut, so the scalpel will not be used. Also, the keyhole vasectomy is also one of the new method. Now we see that here, what do? This is the vas deferens. This is the vas deferens. Okay, let us take black color. Yeah. So this is the vas deferens. They are going to cut 1 centimeter of the vas deferens. Here 1 centimeter of the vas deferens is cut out, and followed by the this thing cutting out. After clamping it, 1 centimeter of the piece of vas deferens will be removed, and now the ends will be ligated. After that, the ends will be ligated and they will be folded back and sutured. After cutting and ligating, they are going to suture it. The ends are going to be ligated, they will be folded back on themselves, and then we'll suture it in the position. And also we'll make sure that the cut ends will face away from each other. Now, it is very important that the cut ends have to face away from each other so that we avoid the recanalization of the cut ends. Okay. To avoid the recanalization, they have to face away from each other. It is important to stress that the acceptor is not immediately sterile after the operation. We also have to make sure that the patient has to be advised that he is not completely sterile after the procedure. The person is not sterile until when? After 30 ejaculations or 3 months post vasectomy. We have to tell that the person has to still continue to use the various contraceptive methods in order to avoid the childbirth or conception, because he is not sterile yet. Followed by 30 ejaculations or a period of 3 months after the vasectomy, he becomes completely sterile. Now, okay. It is the new method we studied. The most cost effective family planning method is vasectomy. The most effective, cost effective, it is worth or cost effective family planning is vasectomy. It is a pre-PG question which is asked in the previous question paper. If they ask which is the most cost effective family planning method, it is complete sterilization, under which if we have vasectomy, that will be your option. Followed by the vasectomy, the patient has to be advised to avoid the bath for 24 hours after the operation. Okay. The person is not sterile after 30 ejaculations 3 months post vasectomy. The T-bandage has to be used for the support for 15 days, and the site of vasectomy needs to be kept very dry. Also, the person has to avoid cycling, lifting heavy weights for a period of 15 days. He has to maintain a little rest to the body. He has to avoid lifting heavy weights, cycling, physical exertion has to be avoided. What are the after effects of vasectomy? Now, there are certain after effects or the complications which may arise following the operation. The early operative complication could be the pain, the scrotal hematomas or the local infection in cases of septic conditions. Wound infection usually people report. Also, we see that the just the antibiotics will reduce this pain and infection and everything. Administration of antibiotics will reduce the risk of these complications. Now the main complication is the sperm granules. What are the sperm granules? The sperm granules will be formed because of the accumulation of the sperms. Though, so now here it is ligated and it is folded back. Now what happens, the suturing is done here. Now all the sperms are being collected here. Because of the accumulation of the sperms, there will be sperm granules, which is quite troublesome to the patient after the vasectomy. And usually this occurs after 10 to 14 days after the operation. The mass will be quite hard and it will be around 7 mm. Okay, this sperm granules will provide a medium through which the reanastomosis of the vas deferens can occur. We have the failure rates of vasectomy. Failure of vasectomy, it is because the sperm granules will be formed, which will lead to a way of recanalization of the vas deferens. Now let us see the other complication, which is spontaneous recanalization. We know that the epithelial tubes, will undergo epithelialization, and following the epithelialization, what happens? They can recanalize, and again it can result in a failure. And also we see that the recanalization will occur in about 6%, and its occurrence is quite serious. Now we see that because it can lead to unplanned pregnancies and lots of anxiety and tension. Unplanned pregnancy can cause a lot of mental disturbance to the couple. Now, autoimmune responses. We see that vasectomy is said to cause an autoimmune response to the sperm. Now, when we block the vas deferens, it will cause the reabsorption of the spermatozoa, and the body starts developing antibodies against the sperm. Autoimmune, what it means? The body starts developing antibodies against the sperm, and thereby this fertile man will have this circulating antibodies against his own sperms in the body. And by this circulating antibodies will subsequently lead to the fertility, despite of the reanastomosis occurring. Despite of this reanastomosis, it can further lead to a failure. Autoimmune responses will develop in the body. Psychological, some men will complain of diminution of their sexual vigor, or impotency can be reported, headaches, fatigue. All such psychological effects are seen in the men who have undergone the vasectomy. Under the emotional pressure, if they have undergone this vasectomy, then they are likely to develop some psychological disturbances. Now we see the percentages. Sperm granules, which is a painful mass, and spontaneous recanalization occurs in 0 to 6% as discussed, and this autoimmune response is 54%. Now let us see what are they talking about the failure of vasectomy. Most probable cause of pregnancy after vasectomy is the surgical failure. That is MCC, mistaken identification of vas deferens. Now mistakenly understanding some other mass of a tissue or other thing as the vas deferens, and taking 1 centimeter of it, clamping it and everything, but then mistaken something else as vas deferens, and that could be the main cause. The failure rate is 0.15 per 100 women years, and the confirmation of successful vasectomy is done by the smear of squeeze of vas by Wright stain. So we see that we squeeze the vas deferens and take a smear of it, and followed by taking the smear, we stain it by Wright's stain. Remember this, we stain it using Wright stain, followed by the smear, take a smear by squeezing the vas deferens and stain it with Wright smear and check the fertility. So this was all about the male sterilization. Another new male sterilization which has been introduced is the injectable silicone plugs. There are two types. We have medical grade polyurethane injectable plugs, and also medical grade silicone rubber. So we see that M stands for medical grade, PU for polyurethane, and SR for silicone rubber. They are injected into the vas deferens, which further solidifies and blocks the vas deferens. Now here in the picture you can see that The sperm produced in the testes are transported through a duct. Now, basically, we are starting with the physiology, what happens. Now, the sperms which are produced in the testes will be transported through, they are stored in the epididymis, followed by the transportation through the vas deferens, through a tube known as vas deferens. So, they are speaking about the production, the storage occurs, and the transportation occurs through the vas deferens. Now, this Vassal gel is inserted into the lumen of the vas deferens. Okay, once this silicone rubber tubes are inserted, this vassal gel will fill the interior, and thereby it will solidify there and become a jelly kind of barrier, and this barrier will not allow the sperms to pass through. The sperms which are too big to get through the gel barrier, and thereby the sperms will end up being reabsorbed in the same body, they die there, and the blockage will occur because of this gel barrier, and they are not transported, and thereby the ejaculation contains no sperms. It is injected into the vas deferens. You see that these tubes, they are injected into the vas deferens, which will solidify, followed by blocking the vas deferens, and thereby they will stop the sperm transportation, and this procedure is done under the local anesthesia. Now, let us move on into female sterilization. Female sterilization can be done as an interval procedure. It can be done in 22 to 60 years of females. It can be done followed by postpartum or at the time of abortion. Two procedures which we know are mainly in use. They are mini laparotomy and also laparoscopy. Let us start with this. Female sterilization have to be done at least one child, more than 1 year of age. Now, the female sterilization has to be done. They are saying has to be done in a woman who has born at least one child, and the age of the child should be 1 year and above. Why is this condition? It is because the child is at a high risk of mortality during the initial 1 year of his life. Infant mortality, all such kind of mortality rates are very high in the children less than 1 year. So once the baby reaches 1 year, and if the woman feels her family is complete, and then you are eligible to perform the procedure. The technique we saw, there are two: laparoscopy and mini lap. Starting with the laparoscopic procedure, it is a technique wherein the abdominal approach will be made. Here we do the abdominal approach in laparoscopy, and we use a specialized instrument which is laparoscope. You know, we are very familiar with laparoscopy, wherein a laparoscope will be used, and the abdomen will first be inflated with the gas using carbon dioxide, or we use air or nitrogen oxide, and now the instrument after will be inserted into the abdominal cavity so that they can clearly visualize. You can see laparoscopy, which contains the camera in it, so that you can visualize the tubes there. Once you feel the tubes are accessible, then you clip the tubes, followed by the ligation and suturing it. It is a short operating term, short hospital stay, and a very small scar are present, which are the most attractive features of this operation. Why people opt for this operation? It is because very short stay in hospital, and the scar which leaves behind is also very small. And the patient's selection for laparoscopy is that the postpartum, during the postpartum period, we that's the ideal type, which we'll discuss in the next sentence. So we see about the other thing, that is mini laparotomy now. So we see that laparoscopy is undertaken in those centers where the specialist obstetrician, gynecologist are available. We know that an obstetrician or a gynecologist, OBG specialist has to carry on this laparoscopic procedure. Now we are talking about mini laparotomy. Mini laparotomy is a modification of this laparoscopy, wherein a simple procedure, it is a comparatively much simpler procedure, which is requiring the abdominal insertion, which is just as small as 3 centimeter, and it has to be just done under the local anesthesia. We know that mini lap, it contains Pomeroy technique. This Pomeroy technique is considered to be the revolutionary procedure in cases of female sterilization. This female sterilizations can also be done under the mass campaigns. There are suitable procedures at the PHCs, under the mass campaigns, and the primary health center levels also this can be done. And the advantage is that with regard to safety, efficiency, and easily dealt without any complications. So it is usually suitable for the postpartum women. Now, let us see that female sterilization accounts for 85%. Now, what is the difference between the male and female sterilization? Female sterilization is performed 85% and male sterilization is 15% of all the sterilizations which are occurring in India. So, male sterilization is very less compared to female sterilization. Always the women has to opt for the sterilization. Just in India, popularly we see that females will go for sterilization procedures. Ideal time we saw that for performing this postpartum sterilization as per the government of Indian guidelines is 24 to 7 hours of delivery. So the postpartum period wherein the woman is still at the hospital, 24 hours to 7 days. So the interpersonal communication with the women is also very easy during that period. You can little motivation is required. You can tell your family is completed and encourage her to opt for sterilization. The tubal block will constitute for 30 to 35% of female infertility. So, the female infertility, the tubal blockages are one of the major cause for the female's infertility. Okay, so there is another method which is introduced in female sterilization, which is Essure. It is a permanent sterilization procedure for the women which is done in USA. Micro inserts are placed into the fallopian tube by a catheter. So we see that Essure is inserted by a catheter through the vagina, cervix, uterus, and it enters the fallopian tube. You can see here, through the vagina, cervix, uterus, and it reaches the fallopian tube. So you can see that Essure insert. We saw the Essure insert. Clear, guys? Essure insert. Now let's see. The micro inserts are placed into the fallopian tubes with the help of a catheter. They pass from the vagina through the cervix and the uterus, and then they enter into the fallopian tubes. This device is designed to elicit the tissue growth or the scarring. So now, what do they do with this Essure? They are designed in such a way that the scar tissues will start to develop into the coil. And in and around the micro insert, to form over a period of 3 months, an occlusion or a blockage is formed in the fallopian tubes. They are voluntarily creating a blockage in the fallopian tubes so that there is no fertilization occurring. This tissue barrier formed will prevent the sperm from reaching an egg. After the 6 months of histosalpingography has to be performed. In order to confirm the sterilization, we do the histosalpingography, HSG. So very clear, guys, this Essure will be inserted from the vagina through the cervix and to the uterus into the fallopian tubes. After the period of 3 months, the scar tissues will start to wrap around the coil, and thereby they will act as a blockage and prevents the sperm from reaching the ovum and the fertilization, thereby acting as a terminal method of contraception. Moving on to the sterilization equivalent. So we have something called sterilization equivalent, where a common unit is used to compare the populations which are using the different methods of contraception. So we know that one population will be dominantly using barrier methods like condoms, diaphragms, and so on, and the other part of the population could be using intrauterine devices, and the others could be using OCPs, hormonal methods of contraception. So in order to give one equal value to all the different populations who are using different types of contraceptions, they have given one equivalent sterilization, tubectomy or vasectomy, will be equivalent to 3 IUDs, or one equivalent sterilization will be equivalent to 9 equivalent OCPs. To be equivalent OCP user, minimum 11 months of OCP use is mandatory. To consider the population to be using OCP, at least for a period of 11 months, the women or the male, whoever, we also know that male like OCP, gossipol and all of those which we have discussed in the previous videos, they to consider the couple to be using OCPs, it is mandatory that they have to use it for a period of 11 months. And also for the equivalent condom user, he has to use of more than 72 condoms per year is mandatory. Now we see that one equivalent sterilization will be equivalent to 3 IUDs, 3 IUD. It will be equivalent to 9 OCP, 3 IUD, 9 OCP, and 18 condoms, So we see that 3, 9, 18. 3 is what? IUD, 9 OCP and 18 condoms. Clear, guys? 3, 9, 18 IUD, OCP, condoms. To be equivalent to, they have to use more than 72 condoms per year. So I hope the sterilization equivalent is clear. With this, we come to an end of the sterilization. I hope everything is clear. If you have any doubts, put it in the comment section, and if you like my video, hit the like button and subscribe.